Hello, Andrew Colsky with Stop My OCD, and today we're going to uncover the secret to stopping OCD compulsions. Those of you who suffer with OCD do compulsions to make yourself feel better, but they only work temporarily, and then you find yourself right back in the cycle. So let's talk about how to stop OCD compulsions. So in this presentation, I'm going to unveil the secret to stopping OCD compulsions once and for all. Interesting. I know that by the time that you watch this video, you've probably tried multiple different tricks and methods that you found on the internet to stop your compulsions. I also know that you're watching this video because none of them has worked for you. So you ask yourself, can I really stop my compulsions, or am I doomed to a life of misery? It's because of this thought process that I've decided to unlock the secrets behind OCD compulsions and show you how to stop them. So let's get started. To understand the secret, first we have to understand where compulsions come from. Let's watch. Okay, we're going to talk about the OCD process here. And first, we have what I call the here and now. And in the here and now, we have some kind of a trigger, maybe something we recognize, maybe something we don't even realize happens, that starts an obsessive thought. So this happens in the here and now. The next part of the phase is what I call the OCD cycle. And in the OCD cycle, we start off with obsessive doubt. So we've taken the obsessive thought, which might be, maybe my hands are dirty, and we've turned it into obsessive doubt. Well, what is the difference? Doubt is when we have all of the facts, but we don't believe them. So we can look at our hands and see that they're clean. We can smell our hands. They don't smell dirty. We can feel our hands. We don't feel anything on our hands. We know that since we woke up and took a shower this morning, we haven't touched anything dirty. We have all this information that's factual. But when we move over into the OCD cycle, for some reason, we don't believe it. So what happens when we have obsessive doubt? Well, it makes us start to think about the consequences. Well, gee, if my hands are dirty and contaminated, I might contaminate everything else that I touch. And if I do that, well, I can get sick. I could even die. Horrible, horrible things. So if those are the consequences I'm thinking of, what's going to happen? I'm going to feel distress, lots of distress. Well, if I feel distress, oh my God, I can't handle this all the time. What am I going to do? Well, what I'm going to do is I'm going to do a compulsion, because a compulsion makes me feel less distress. In this case, if my obsessive doubt is that my hands are contaminated and dirty, and then the consequences are I'm going to spread it all over the place and I'm going to get sick and I could even die. Oh my gosh, all the distress. Well, the compulsion is, let me go wash my hands and then I'll know that they're clean. Until OCD comes back and says, yeah, but what if you didn't really clean them all the way? They still could be dirty. Oh my God, if they're still dirty, there come the consequences. I could get sick. I could spread the contamination. Whoops, distress, right back to the top and back into the compulsions. So if you have OCD, you know this cycle. That's what happens. So you get stuck in that OCD cycle once you've entered the obsessive doubt, and it's hard to get out. This is why you have the compulsions. So as you see, the purpose of a compulsion is that you do it to lower the distress that comes from your obsessive doubt. But you also see that obsessive doubt and compulsions are both part of the OCD cycle. So logically, if you never entered the OCD cycle and didn't have obsessive doubt, then you would not feel the distress that your compulsions are designed to alleviate. If there's no distress, there's no compulsion. Okay, makes sense. But I know what you're thinking. Easier said than done. If I could avoid the OCD cycle, don't you think I would have done it? Well, this doesn't help me. But wait, you can avoid the OCD cycle. The problem is that you don't know how to do it. So try this. If I give you 10 bowling pins and I ask you to line them up in 5 rows of 4 pins, can you do it? Think about that. 10 bowling pins lined up in 5 rows of 4 pins. Can you do it? Well, I bet you believe that you can't do it because you said to yourself, well, let's see. If I have 1 row of 4 pins and then I have 5 rows of 4 pins, then I'm going to have 20 pins. But I only have 10. So of course I can't do it. Well, it seems like it's just as impossible as trying to stop OCD compulsions, right? Well, but remember, I said you can do it. You just don't know how. So the truth is that it's not that you can't do it. It's you don't know how to do it. Wait for it. Once you learn how to do it, you'll never forget. Watch what's coming. So what's the secret to stopping OCD compulsions? Take a look at this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 bowling pins, 1 row of 4 bowling pins, 2 rows of 4 bowling pins, 3 rows of 4 bowling pins, 4 rows of 4 bowling pins, and 5 rows of 4 bowling pins. You just did what you said you couldn't do. So now you understand when I say once you know how to do it, you find that you can do it. So again, let's look at the process here. We've got the here and now, we've got the trigger, we've got the obsessive thought. That's all happening based on fact. Then we have the OCD cycle. How does it start? Obsessive doubt, consequences, distress, and compulsions. So once we move over into obsessive doubt, we're guaranteed to have the compulsion because it's a never-ending cycle. So in OCD treatment, when we focus on the distress and the compulsion, we do what is called exposure and response prevention therapy. Now you'll notice that distress and compulsions are the symptoms of OCD. They're not the root cause, they're the symptoms. So exposure therapy, while it is effective and while we do use it, it is designed to focus on the symptoms. So what happens if instead of focusing on the symptoms, we focused on the cause? We found out how not to move from obsessive thought into obsessive doubt. And so if we never enter the OCD cycle, we don't need to worry about any of the steps in the cycle. We can stay in the here and now. And if we therefore are not in the cycle, we never get to compulsions. So how do we stop compulsions? We don't enter the OCD cycle. How do we not enter the OCD cycle? By learning to stay in the here and now. How do we learn to stay in the here and now? That takes a little bit of work. That's why we have therapists that are specifically trained in treating OCD. But again, it's not that it can't be done, it's that you don't know how to do it. So the traditional treatment for OCD is ERP, exposure and response prevention, or exposure and ritual prevention. It focuses on the symptoms, not the cause. If you treat the cause, then you don't need to treat the symptoms, right? Every patient is unique and requires an individualized treatment plan, and the patient-centered approach leads to the best opportunity for success. What I have done is I've developed something that I call DRIL, D-R-I-L. It's a proprietary treatment methodology that both treats the cause of the obsessive doubt and, through skills building, inhibits future distress. DRIL stands for Doubt Reduction and Inhibitory Learning, and it's composed of a combination of inference-based therapy, cognitive behavioral therapy, and exposure and response prevention. So the secret for stopping compulsions is never to enter the OCD cycle in the first place, because that's the only time you're going to get compulsions. And the way that you don't enter the OCD cycle in the first place is to deal with the cause rather than dealing with the symptoms. Makes a lot of sense. At least it works for my patients. So if you want to learn more about OCD, or if you're someone who is a caretaker or loved one of someone with OCD, join our free support group at stopmyocd.com. And we talk about all these types of issues and opportunities for treatment methodology, and we're there to support you. So take a look at this and other videos, and we cover a lot of different topics that should help you or anybody with OCD. So thanks for joining us today.